Welcome to Pursue Wellness. This show is by chiropractors and for chiropractors, helping you with practical science for better patient results, physiology and labs, rehab and exercise, supplements and nutrition, unfounded trends, no opinions, just science. Let's get started.
Hey there, I'm Dr. Callerina Woodard, and today we're going to be talking about why, when it comes to supplementation, nutrition, lifestyle, training, anything like that, we need to take the person, individual, into complete context. Because N does not equal 1. Now, I'm going to explain what that means, but it's not a one-size-fits-all in everything regarding health. And the more I learn about health, the more I find that to be even more true. You have to take each person individually, including yourself, into account whenever we see new health trends or supplementation recommendations or lifestyle modifications. So let's get into it. Like I said, each person needs individual consideration when it comes to anything health-wise, because what worked for one person might not always work for the next person. And what I mean by this, I'll explain. First off, what is N equals 1? What does that even mean? What does N does not equal 1 mean? N just means the number of people. N equal 1 meaning one person's experience being the same for all. That's never the case. I will not say never. Rarely the case. And that's because of individual considerations like biology, environment, lifestyle. One person's input could be a total different output for someone else. And what I mean and why this is even important is because you have to realize in today's society, we are being pushed all types of things via marketing. This detox worked for me, therefore it's going to work for you. I lost 100 pounds doing this, therefore you need to spend your money and do this. This juice cleanse helped me get rid of these parasites, therefore you need this so that you can have better mental clarity and weight loss and better metabolism. Bulletproof coffee helped me get up and go in the morning, therefore everyone should drink bulletproof coffee. I could go on and on. Fasting, all these new, not even going to say new, but all these things that are being marketed that worked for one person might not work for everybody. So we have to take that into account. When I say context is everything, what I mean, genetics. Think about it. One of the most, I would say, common things that people talk about now, the MTHFR gene. So someone could say, you need to drink this supplement or drink this energy drink and it's going to make you feel better. However, the B vitamins in that energy drink may make one individual with some kind of genetic SNP feel awful. And then they're like, well, now I'm going to have to chase all these other symptoms to figure out what's going on. When in reality, that just because that thing worked for one person is not going to work for them. This is the same with gut health. Not everyone has to be on the same elimination diet. We all each have individual, unique microbiomes. And yes, there are things that are healthy across the board microbiome-wise, but a lot of the things that are pushed for gut health do not take individual consideration into account. Their environment, their activity level, how much are they training? If they're training at all, do they exercise at all? Do they move at all? Things like this are all going to impact the outcome. Nutritional status, toxin exposures. Think of how many people recommend detoxes and cleanses to someone who's extremely toxic and might not be ready for that Hershmeyer reaction that they're going to get. And then that person has that reaction and they're like, well, why didn't this work for me? And they don't fully understand their specific context. Same with hormones. One person's hormones, how they metabolize estrogens might be different than someone else's. One person's stress tolerance might be different than someone else's. So one recommendation can impact someone else with a different profile, completely different. A little bit more specifics on genetics. How our bodies process things can be different from one person to another. And this is all based on genetics. How well someone detoxes. Methylation, we talked about that with the MTHFR. That's a pretty common one we see, but there are so many different genetic variations that can impact how well someone is going to metabolize their hormones and their nervous system response to something. Take, for example, caffeine. Some people can metabolize caffeine really well. Some people can metabolize caffeine terribly. So one recommendation for one person would, when it comes to, well, whenever you take this, take it with caffeine so that you absorb it better, might not work for the next person. So we need to be flexible when it comes to things and take that person individually, their genetics into account. The next thing being their gut health and their environment. How well do they absorb things? How well are they absorbing their nutrients? Because if they can't absorb things well and they end up just bloated or uncomfortable or with even more dysbiosis because of a new cool detox or gut cleanse or juice cleanse that you might be recommending to them, that's going to impact that person differently than it would someone else who has a totally different gut environment. Another example, I mentioned stress or someone's ability to metabolize hormones. A high stress person, we'll just take fasting as an example, is not going to do nearly as well intermittent fasting as someone who focuses on recovery or has a different stress response adaptation. Same with hormones. Someone in menopause or postmenopausal may and will respond differently than someone in their 20s who is not going through a hormonal change. So again, context. This is where we look at high performing people that try to go, push. CrossFit's definitely going to work for me because it worked for this person 15 years younger than me, so I'm going to train the same. And then they have terrible outcomes, so many more injuries, so much more inflammation, and they're not getting the results that they want because they don't take into account the hormone variation and their ability to adapt when it comes to those stressors. Supplements are not universal. And what I mean when I say this is like, think of B vitamins. I mentioned MTHFR already. It's just the easiest example that comes to mind. So for some people, B vitamins are great. They're going to help with cellular energy. They're going to help with metabolism. They're going to help your whole body function better. And we need these B vitamins. But for someone who might have that SNP or someone who might not process these vitamins very well because of something else impacting that, it can make them feel so much worse and it can cause anxiety. Same with immune system supplements. We want to think of these as something that boosts immunity. Take like echinacea, for example, or elderberry, or tons of vitamin C. But if someone has autoimmunity, it can definitely worsen those symptoms and cause more flare-ups in this person. Hormone therapy. I talk about hormones with people a lot, especially women who come to me and they're like, well, I was recommended to take estrogen. My doctor recommended that they put me on this estrogen this estrogen patch because I am perimenopausal. And then we do a Dutch test and we look and we're like, you actually have great estrogens and they are metabolizing perfectly. You clear them well and they're going down the right pathway. You don't need any more estrogens. So when it comes to hormone therapy, it is not a one-size-fits-all. We really need to take that individual and their hormone profile and their history and their androgens and everything that they metabolize along with cortisol in effect before we treat with any type of hormone therapy. Again, N does not equal 1. Just because this hormone therapy worked for this celebrity does not mean it's going to work for everyone. Your physiology does not equal my physiology if that's the one thing you take away from this. You are an individual. Your patient is an individual. I am an individual. So when it comes to treating these people, just have it in your mind. I'm going to listen to their experience. I'm going to see what has worked for you in the past, what has not worked. What do you have reactions to? What do you get bloating from? And then not be set in stone for any protocol, because I may have seen this work really well for 50 patients prior to this. But then this patient, I'm not going to discredit them as soon as they're like, something's not working. I'm going to take a step back and I'm going to say, okay, what's worked for you before? Why isn't this working? Let's think about your genetics. Let's think about your lifestyle. Let's think about your day-to-day, your environment, and then adjust the protocol accordingly. And then educate the patient on this. This is going to help so much with retention so that they trust you more. When it comes to educating them on, we need to figure out you as an individual and then how you're going to respond. And then the test, don't guess. We talk about this very often, especially in regards to x-rays, but we're going to test them if we're starting to be suspicious of something more in depth going on, so that we can make objective findings more solid, something that we can actually use when it comes to treatment. This is a simple concept. You know that you are different than the person sitting next to you. You know that you are different than your husband or your wife or your mother or your father. There are a lot of similarities, but you have to learn how to know your body. Our patients need to learn how to understand and know their body. So with all the things that are being thrown at us, supplements, diet plans, now we're going to do carnivore. Oh, actually, we're going to do vegan because this worked for me, because actually plant-based works for me. We need to know what works best for us and be able to see the signs that this is actually moving my health in the direction I want it to versus pulling me away from health before we get stuck on one specific path for too long. Or take into account that some of the people marketing these things to me have their own individual experience, and I have my own individual experience. So I need to take a more strategic framework, a more strategic thought process whenever it comes to implementing something into my health. I hope this is helpful, and I hope you have a great rest of your day.